Hello, I'm Dr. Monica Kraft, System Chair of Medicine at Icahn School of Medicine at Mount Sinai, and I'm here today at the Aspen Ideas Health Festival with Dr. Alan Copperman. I'd like him to introduce himself, and then we'd like to talk a little bit about infertility and some of the innovation and advances in that space.
Hi, I'm Dr. Alan Copperman. I'm the Vice Chairman of Obstetrics and Gynecology at the Mount Sinai School of Medicine in New York. I'm also the Division Director of Reproductive Endocrinology and Infertility, and I run the IVF program, RMA of New York.
Great, well, great to have you. You know, the area of reproductive medicine has just exploded, and so I want to ask, how important is genetic assessment for people who are trying to have a baby?
You know, having a baby is not just about the right eggs and the right sperm at the right time. It's actually about preconceptual health. So you can take a couple before they're even ready to have a baby and test them for hundreds of genetic diseases, recessive conditions that they don't have, but together they're at risk of having an unhealthy baby. In fact, 4% of couples are at risk of having a baby with a disease that could be identified before they even get pregnant or in an embryo, or at least prepare them for having a child that may have some health issues.
Wow, okay. And so along those lines, and why is it so important to know your family history, and how does it affect your fertility and cancer risks?
Family history is so informative. When you talk to a patient, it's not just about their own health, but their parents, their grandparents. We can learn enough. There are couples that have cancer in their mom and their aunt and their uncle, and if we hear about it, we can do genetic testing, and if they're at risk of having a genetic disease that causes cancer, then we could screen them, we could treat them, we can intervene, and we could also help them and inform them about what options they have for having a baby that maybe doesn't express that gene.
Absolutely. And speaking of genes, there's a couple that have been identified now for a while, the BRCA or Broca genes. Could you talk a little bit about those mutations and what patients should know?
Sure. Sometimes you see a family that has a history of breast cancer that has occurred at a young age, or ovarian cancer, and they've of course gone to a specialist and they've had genetic testing done. And some of them, the genes, these tumor suppressive genes like BRCA1 and BRCA2, can reside in families. And if a patient finds out that she carries a mutation, then she can go for early screening and early intervention. And we can also save her eggs or prevent their embryos from transmitting the disease to the next generation.
Right, and along those lines, this pre-implantation genetic testing that you were talking about, why is it important?
So we've entered this era of precision medicine, where we're not only taking an embryo that looks healthy and putting it into a uterus, but we could test the embryo for hundreds or thousands or a myriad of conditions. For example, routinely we test the embryos for the number of chromosomes. So if the embryo has Down syndrome, then we may not choose that embryo, but if an embryo is 46XX female or 46XY male, we would choose that embryo, transfer it, and have a very high likelihood on the very first time of having a healthy baby.
Wow, that's amazing. And really important. I think knowledge is power here. And so along those lines, is there anything else you'd like to tell the folks about advances in innovation in women's health?
This is the time to put a spotlight on women's health. By taking a thorough family history, by availing ourselves of genetic testing, by streamlining processes and using big data to personalize treatment, we can help a patient, a woman, a man, a couple, get pregnant as quickly as possible in a streamlined, efficient way and have a healthy baby. I mean, that's what it's all about. We're preventing disease and we're creating healthy families.
Absolutely. Well, thank you so much for being here. This was great.
It's a pleasure.
Definitely. Thank you. Thank you.